Hi everyone. Today's teaching assistant is called Chicken, or Chicky for short. I did not come up with the name. Anyway, Chicky is not happy about being on the counter, so Chicky's going to go back on the ground. Goodbye, teaching assistant. Alright, today we're covering the second part of the case context. So how we actually end up using these assessments and tools and techniques that we learned last week. First, we're going to learn some differences between these assessments. We're going to talk about the informal assessments, and we're going to talk about the 5 whys. And lastly, we're going to talk about the role of assessments within the social work profession. As a reminder, assessments are all part of assessing the case context. So the case factors, information, and gathering information and asking questions, that's what we really talked about last week. Now we're going to talk about how the assessments influence what we find out about the history of the child and their strengths and needs. So who conducts the assessment is really crucial, especially in regards to training and the attitudes that they hold. So your positionality in this world influences how you view other people. This is entirely unintentional. It's an unconscious product of how you're brought up. And that's why when 2 different people conduct the same assessment on one family, it can sometimes come up as slightly different. If one assessor had an upbringing and social situation growing up that's very similar to the family being assessed, they'll sympathize more with them and recognize themselves in the situation, and some of the commonalities will impact what they view as strengths versus needs. Whereas someone who grew up in a completely different situation and isn't able to identify or recognize themselves within the family situation will have a much different understanding of what the family's needs are. So what is very important for you is to recognize your positionality and how that will impact how you view families. One of the most frequently viewed issues within child welfare and those doing home visits is messy or dirty homes. So the cleanliness within the home and the amount of clutter and just garbage everywhere could be something that you're very not used to seeing. But it's very important to contextualize that experience. Don't just assume that the people who live in a messy home are messy. Remember that they also have very high limits on their time, their ability to clean, whether anybody even showed them how to clean, whether they even have cleaning supplies or just garbage bags to get some of that garbage outside. So consider every time you walk into a situation like this, how does your relationship with the service user in your view of their situation impact your assessment? Assessments do not always have to be formal tools that we check boxes on. We can also conduct assessments informally, just through conversations. And these assessments typically take place over the phone or in the client's home as we're trying to get to know them. And they're very important because they serve to start to establish that therapeutic relationship. With a therapeutic relationship, you're going to get much more forthright and in-depth answers than without that relationship, because the client is able to trust you and to share their actual needs and concerns. One way that you can get to the root of the problem, so what the actual concerns of a client or service user are, is the 5 whys exercise. This is an exercise that can help either you or you and your team explore the knowledge and you have about an issue, and see if maybe what you are initially looking at as an issue isn't just, something underlying it. For instance, here's an example. There's young youth who's repeatedly suspended from school. So that's the presenting issue. And then we ask why. Why is he being suspended from school? That's our first why. And the reason is because he keeps getting into fights. Is this the root cause of what's happening? No, probably not. So we ask why a second time. Why is he getting into fights? Because he's angry all the time. So is this presence of anger the root cause? No, there's something causing the anger. So we ask why yet again. Why is he angry all the time? Because he doesn't have a lot of friends at school. Again, not a root cause, so we keep going. Why? Why doesn't he have a lot of friends at school? Because his family has moved several times the past few years. So we're seeing frequent disruption of the home environment and his ability to form social bonds. So this is one potential root cause. We could go further as well. Why has the family been moving? Are finances an issue, or are one of the family members in the military, for instance? Those also will affect how you'll deal with the youth and what interventions you might suggest for the family. So if you keep asking the why, eventually you will get to the actual issue. And that's what you have to address in order to change the behavior that led to the referral in the first place. So we mentioned a little bit already on how your own experience can bias how you conduct an assessment. And this is viewed and evidenced through such thing as the language you use. For instance, how do you even refer to clients or service users? How does the agency refer to them? And then also your own culture. It will impact how you understand other cultures, your exposure to media. If you're constantly watching news sites like Fox News, you'll hear some very derogatory words used against people from the Middle East, people who are trans, etc. You have to be very aware that many of these terms are not okay. We also have differing abilities, and many people have invisible disabilities that will impact how they process information and how they engage with you. For instance, people on the autism spectrum might avoid eye contact, or they might not, because the experience varies widely from individual to individual. Certain things such as difficulty seeing or being hard of hearing might not be apparently evident until you spend more time with a person. Dyslexia often goes undiagnosed in especially male students because teachers just assume that they don't want to pay attention to their schoolwork, and that's why their schoolwork is sloppy or not done. They don't look at the why of the issue and why is the schoolwork not done? What could possibly be preventing the student from engaging with the schoolwork, as opposed to just assuming they don't want to do it. Similarly, we make assumptions about people based on their gender or gender identity, their race, and their age. Some of these assumptions can be what's known as positive discrimination. For instance, when you hold the door open for somebody who you judge to be elderly, or you offer them your seat on the bus. These can be quite helpful, but at the same time, you are assuming something about that person, which then changes your behavior. With something minor, like holding the door open, that's not a problem. But when it comes to major things such as conducting an assessment and assuming that because your client is elderly, they're not able to answer your assessment questions themselves, so you're always looking at a family member to answer the questions instead, that then becomes very dehumanizing. So be very careful how with all of these and be aware and self-reflect on how they might be impacting how you deal with people and how you conduct your assessments. You're going to be watching two short videos after this lecture video. They're both on YouTube. Just click on the links within Blackboard and they'll take you there. One is on social work skills. skills, and the next asks you to really think critically about assessments, especially within the educational setting. So why do we always ask you to think critically? Because it's very important not to accept things for granted, not your biases about people or your own positionality, and also not to accept without question your field site's approach to assessment. Consider, from an outsider perspective, are they really collecting the information that they need to be collecting in order to conduct a proper assessment and provide the best services? Sometimes things have been going on the same way for so long within our organizations that they stop checking in to see, is what they're doing still working the way it used to? Are there new aspects of information that need to be collected in order to have a complete assessment? For instance, those of you working with children know how important technology and social media is to them. In conducting assessments as to whether they have a friend support group, you might focus only on friends who are at school or in real life, whereas the youth might consider their friends through their gaming system and social media to be just as important to their social support network as the in real life friends. So consider, is the agency conducting and using assessments to assess client needs in the best possible way? Is there potentially something missing? What information is being passed along between workers and agencies? Is it just the information that needs to be, or is it something extra that could be seen as violating clients' confidentiality and right to privacy? What information are you gathering from service users within this situation, and is potentially something missing? So, as you're doing assessments within your own placements, think critically about the assessments themselves, about the information that's being collected, and about how it's used. Is it really the most effective and efficient way of meeting the client's needs?